The sun, it said about, an hour ago, leaving us with nearly 15 hours of darkness. Here to explain why long winter nights can be a big challenge for some people is Dr. David Michelin, the director of the Depression Clinical and Research Program at Mass General. Thanks for joining us, doctor. So you've treated a lot of patients of seasonal affective disorder. How do you diagnose it?
Thank you. Seasonal depression is basically a form of major depressive disorder. It tends to occur in the fall and winter months and then usually alleviates or fully remits in the spring. The symptoms are essentially the same as for other types of depression. So the person may feel depressed or down most of the day, nearly every day, and they may also notice a loss of interest or enjoyment in their usual activities. There are other associated symptoms, for example, sleep disturbances. In the case of seasonal depression, the tendency is to want to sleep more than normal as opposed to less than normal, which we see in more common types of depression. We might see other things like fatigue, trouble with concentration. Appetite can be disturbed as well. Again, in seasonal depression, we often see carbohydrate cravings, the urge to eat more sweets, whereas in other forms of depression, people may often lose their appetite.
Doctor, let's talk a little bit more about those symptoms because some of them at least sound relatively mild. So what do you recommend folks do to manage them at home?
Sure. I always caution people that if they suspect that they have depression of any sort, they should not necessarily try to self-diagnose or self-treat, but get a professional opinion, for example, talking to their primary care doctor about it. In any case, there are things that individuals can do. In particular, for seasonal depression, having more exposure to light can help. There are certain types of therapeutic lamps that can be bought. And by having an exposure a couple of times a day, maybe about 30 minutes a session, that can be helpful. It's been shown in clinical trials that these therapy lamps are quite effective.
Okay, Dr. David Michelin from MGH, thanks for all of your advice and for joining us tonight.